Today, West Virginians, they gathered on Charleston's west side to share concerns about proposed cuts to Medicaid and SNAP. Bailey Tucker, she spoke with attendees. She joins us live right here in studio. And Bailey, talk to me. What are some of the biggest concerns people have now shared?
Well, Peyton, as of May, there are over 500,000 West Virginians who are enrolled in Medicaid. Without it, many aren't sure what kind of health care benefits they could receive in the future and how it could affect rural medical practices across the state.
My brother's never going to be able to stand in front of a microphone or drive to work or even toilet himself independently. And I want our senators, our representatives to know that these people exist.
Mariah Plant serves as the main caretaker for her brother, who is legally blind, nonverbal, and autistic. With cuts to Medicaid, their lives could change forever.
The Medicaid cuts that are being proposed by our representatives directly impact my family in that we may not be able to afford to care for my brother at the standard at which he is accustomed to.
Plant and other West Virginians spoke out today against the House of Representatives budget amid Tuesday's press conference. If the budget is passed, it would cut Medicaid funding by $700 billion. But West Virginia Economic Justice President Lyda Shepard feels a change could happen.
We prevailed in 2017 when they attempted to repeal the Affordable Care Act. And we can prevail again with some fortitude, cunning, and maybe a little bit of luck.
Currently, the total Medicaid spending within the Mountain State is $5.5 billion. West Virginians for Affordable Healthcare Executive Director Ellen Allen says this also impacts the rural medical centers in the state.
There are 7 hospitals that will probably close fairly quickly because they're on razor thin margins. And when people in communities don't have access to health care, then that means if they go to the hospitals are going to have uncompensated care. The hospitals cannot remain open without some form of payment.
Cuts to SNAP are also being threatened in the budget. In 2024, SNAP helped 1 in 6 West Virginians afford groceries. NAACP member Libby Booker says if these cuts were to happen, West Virginians could be in trouble.
States will be required to share at least 5% of SNAP benefits, with costs beginning in 2028. And in a poor state like West Virginia, 5% is a lot.
Postcards addressed to both Senator Jim Justice and Shelley Moore Capito were provided for people to write their concerns about these cuts and urge the lawmakers to vote no.
We will not rest until we hear from our senators loud and clear that they will stand with us, the people of West Virginia, who they have sworn to serve.
Throughout the country, 70 million people are currently enrolled in Medicaid, and West Virginia ranks as one of the states with the most enrollees, currently sitting in the top 7. Live in the studio, Bailey Tucker, Eyewitness News.